Hello and welcome to another episode of Fractional Impact. Today we're speaking to AJ Melaragno about the biggest challenges health systems face in patient access today, practical ways to improve ROI in large transformation projects, and everything else relating to succeeding in the healthcare industry. AJ, would you like to introduce yourself?
Good morning. My name is AJ Melaragno. I'm president, founder of Singola Consulting. At Singola, we focus on optimizing access and intake operations for large healthcare systems across the U.S.
Awesome. And we're joined today by Gianna Maliari from the Fractional Clients team. If you'd like to introduce yourself, Gianna.
Thanks, Stuart. I'm Gianna, part of the Fractional Clients team, and super excited to get into this today with AJ.
Fantastic. So my first question for you, AJ, just to set the scene and give everyone a bit of context on who you are. Tell us, your background and how you started Singola Consulting.
Sure. I've been in healthcare for a little over 25 years now. I started in a healthcare system in the Chicagoland area and worked there for about 10 years, was part of their Epic implementation. And then one of the board members' spouses had a difficult time calling into the call center. And at that point, the CEO called me and said, "You need to fix the call center." And I didn't know anything about it. And the organization realized that they had to fix how patients interacted with the organization. And from that point on, changed my entire career to focus on call center, building them from scratch, fixing those that already existed, streamlining the processes, technology. Worked there for a few more years and then started to travel the country and realized that I can do that for other organizations because they were having similar problems. And that's when I founded Singola Consulting back in around 2011, 2012, and have been working with large healthcare systems, as I mentioned, ever since.
Awesome. 14 years, that's a long time to have the consulting business going, which is very impressive. How have things sort of changed from 2011 up until now, sort of inside Singola Consulting?
I wish I could tell you that the problems were different, but they're not. We're facing the same issues that we did back in 2011. A lot of it has to do with making sure that the processes are changed first before we implement any kind of technology. Because if you just implement technology, you're just speeding up a bad process. And a lot of the issues with schedules and templates are the same as they were in 2011. But what has changed is the technology, and obviously moving towards AI, moving towards using algorithms to guide patients to make sure that they're seeing the right physician at the right location at the right time in a timely manner. Those things have been, I don't want to say automated, but they've definitely been streamlined by technology a lot more than they were in 2011. Still, the challenges are the same, and we have to fight through those.
Yeah. What are the most common operational efficiencies that you see just coming up over and over and over again over the past 10 years or so in healthcare businesses?
I would say the biggest, as if you probably talk to family members and friends, is the fact that they have to repeat information all the time. Every time you call, whether you get transferred or you call multiple times, you have to give them the same information over and over and tell your story again. And what that creates is a lot of, multiple calls. It limits your first call resolution. You have to transfer calls throughout the system, which all of that is costly. So we really try to focus on first call resolution. And in order to do that, you've got to get the caller or the individual going online to the right place and give them the information and empower the call center agents to make decisions. Use the technology that you have in place. But I would say that the biggest issue is that disconnect within the organization, because these organizations are big and they're getting bigger. A lot of mergers, acquisitions, and it's becoming more and more complex.
Yeah. What kind of impact does it actually have on the company and the patients when these things are sorted out in a healthcare company? And how long does it typically take to do that? I appreciate there's going to be a variety there.
Let me start with how long it typically takes. Our engagements usually last between 2 and 4 years. And the reason for that isn't necessarily the implementation of the technology. It's the change management, change controls that you have to put in place, because you've got providers, physicians that are pretty set in their way. But this is how I want my schedule to operate. Don't touch my schedule. It's kind of like the last frontier for them. And when you start working with them, you have to build trust, and you have to build the understanding that I'm not here to make your life harder. I'm here to make your life easier, allow you to practice in the way that you went to school for, the way that you want to practice and interact with your patients. Let me clear the runway for you and make that possible. As far as like some of the benefits of it, anything from reducing that cost per contact. So a phone call typically will cost you $8, we've seen up to $16 per interaction, unfortunately. Whereas an automated or a self-service through the portal will cost $1, maybe $2. So it's a huge cost savings for the organization if they start to streamline their processes. Another piece is just that I would say the multiple layers that you're creating for the patient to navigate through. And, I talk to my mom all the time, and she's at that age now where she is using healthcare a lot, and it's very confusing. It's intimidating for her. So what we try to do is make it, we gear the scheduling piece of this geared for individuals that have no idea about healthcare. And that's really what we have to focus on. If we keep that focus, we'll make the impact that we're all setting out for.
With AI tools expanding rapidly and automation and such, what excites you most about their potential in patient access over the near future?
Yeah, I'm going to say something a little controversial right now, is that AI is being thrown around in healthcare like it's the end all and be all. And I think that in order for AI to work, you have to have the processes in place to allow it to work. And so many times organizations that we come across, they're selling AI. And I think that term is used really loosely. It's more of logic, algorithms, and setting that up for success is really based off of what is the organization willing to do? What is the organization willing to allow the patients to do, whether that's online or through the phone? And it's not necessarily always AI. Again, I started this conversation off with, if you've got a bad process and you just put new technology over the top of it, you're just speeding that process up.
True.
Yeah. It sounds like scheduling is a huge part of your business or what you help clients with, and it can be a huge lever to improve the companies you're working with. What's the biggest misconception about scheduling optimization that you find?
That it's a technology play. We have been with several clients that purchased recently, purchased their new electronic medical record, and feeling that, okay, they're going to implement that. I mean, they're spending $40, $50, $60 million a year on this technology. And they put it in, and then the first question is, well, why isn't it better? It's not better because we really didn't change anything. You had the same processes and standards or lack of standards in your old system, and all you did is move it. And we see the same thing with CCaaS systems, call center systems. Nothing has changed. You're putting in new technology and you're looking for different results. That's the biggest challenge that we have when we go into a client, especially when they're going through the process, their RFP process for assessing new call center systems or assessing new solution providers. They're expecting the outcome to be different than where they are today just by picking a new technology. So I think I would say the technology piece, that it's a technology play, is a misconception. And I also think that the importance of leadership is a misconception of they need to make the difficult decisions. And we have had many clients that have done an amazing job with leadership strategically positioned in the engagement, and they're okay with it. They're making those difficult decisions that are not going to please everyone. But when they don't, that's when the project just gets a little stagnant and you're really not seeing the results that you should.
Yeah. So if a company's listening to this or watching this and they're thinking, okay, scheduling, we need to fix that.
Yeah.
Why would they be better off working with your team as opposed to trying to figure it out themselves?
Yeah, that's a great question. We get that question a lot. The first thing how I'm going to answer that is we have done it. As I mentioned in the beginning, I started off working in a healthcare system for 12 years. Every one of our senior consultants have worked in a healthcare system. We are not just out of college, not that there's anything wrong with that, but we're not out of college. We're not, coming from another industry. We've all worked in healthcare our entire career for most of us. And I think that it is a challenging engagement to get into, but understanding the environment of healthcare and who you need to get on board with certain changes is essential. And healthcare is unfortunately, or fortunately for my business, it's a different beast because you've got a lot of moving parts, and it's very difficult for business to tell clinical operations, this is how you have to operate. It doesn't work that way. And you have to work together. You have to come to the table from the very beginning. And we know how to do that. We do that very well. That is probably our bread and butter, how you bring people together for a common goal. And it's not all perfect ever. There's going to be mistakes, but it's how quickly you change and pivot to remedy that.
Yeah. It sounds from myself as an outsider that the whole healthcare industry, especially in the US, is totally unique. You can't really compare it in many ways to a lot of other industries, but probably one thing that you'll face that is faced in every industry is how do you, for things that are going to require some sort of an investment and some sort of time to improve, the companies you're going to work with are going to want to see the quantifiable ROI from any sort of investment. How do you do that with improving patient access? How do you quantify the ROI on that?
Yeah, Stuart, that's a great question. And we started off, I think this is something, Gianna, that has changed in my business. We started off with, how fast do you answer the phone? What's your abandonment rate? What's your service level? All the warm and fuzzy things. And we probably, I would say maybe 5 years ago, started to change over to quantifiable dollars, because It doesn't matter if I answer that phone in 15 seconds. If I can't serve the patient and provide a solution to the patient, then who cares how fast I answer the phone? So that was a mind shift for every leader in healthcare. It was all about, they would go to, conferences, or they had dinner parties, and everyone talked about, yeah, my phones are not answering the phone in 3 minutes, 4 minutes. That's all they talked about. So we changed the mindset, and still doing it, about, for example, how many more slots am I able to open up on a provider's schedule? So as an example, one project that we worked on, we enabled one new slot per provider per day. This is for primary care. Now, if you think about that, they had, I don't know, call it 80, 85 providers. That's a significant increase in access just by refining their schedule. Now, that goes back to my point earlier of, you can't just do that and expect the providers to say, okay, I'll take on one more patient a day for you and get paid the same. And it just doesn't work that way. We have to figure out, how do we do it in a way that is give and take? So we look at access, we look at cost per contact, hardcore dollars of how much does it cost me to interact with this patient. We try to push everything through self-service or automation, but we don't lose the empathy of the interaction. So meaning, at any point in time, the patient can escalate. The patient drives this. I often have said, you have no idea what's going on the other side of that phone call when a patient calls. They could have just been diagnosed with cancer, or someone in their family just been diagnosed. They are scared. They don't know what to expect. So having empathy with a warm voice on the other end can make all the difference in that person's day. And that's something that you're not going to necessarily get through AI or self-service or any kind of automation. So it's important to drive ROI, but it's also important to be empathetic and understanding of what that patient may or may not even know what they're getting into.
Yeah.
Following on from that, and obviously recent health events like COVID, do you think patient expectations have evolved, and what was the most significant change?
Yeah, I think, Gianna, the biggest thing, and I don't know how you guys are, but I don't want to talk to anyone. If I have a regular, annual physical or an eye appointment or something, I just want to go online and I want to book that appointment, make it easy for me. When it tells me, there's no availability, you have to call. Why isn't my experience online the same as if I was calling? And that's what a lot of the organizations have done in the past, is they would block out certain things and say, well, we're just going to let them schedule online on Monday, Wednesday, and Fridays. If they really need an appointment, they'll call us and we'll have availability on Tuesday and Thursday. Well, do you do that with the airlines? Do you do that when you go to the movies? It's like, that's the mindset. I think COVID actually helped us in that whole touchless communication and making sure that it's consistent. It's a consistent experience, whether I call you or whether I go online. I think there was a lot of bad that came out of that, but I think there was also a lot of good, a lot of, well, if we could do it then, we can do it now. I mean, think about how fast things were developed and processes and decisions were made. I've never seen anything like it. And I worked hard during COVID. We had 2 clients, that one was in Florida, another one was in New York, and they made decisions faster than I've ever seen. And they moved and it worked. And if it didn't work, they would change it and redeploy it. I used to think that if that's how we made decisions all the time, healthcare would be a completely different industry.
Valid.
Where do you find that organizations most often overinvest in the technology side of the business when process redesign would actually deliver more value?
I would say that the whole EMR, the whole electronic medical record side, as I mentioned, they spend millions on this every year. And yet they don't really take the time to go through, for example, scheduling optimization. Scheduling optimization is probably one of the most painful things that we do at Singola. And it's not because of the development, it's not the technology, it's it's nonstop negotiations. It's nonstop figuring out, well, you don't understand my business. This is the provider. You don't understand my business. Nurse Betty at the front desk is the only person who can schedule for me. Well, that's a problem, because if Nurse Betty goes on vacation, now who can schedule? So I would say that they're spending a ton of money on their electronic medical record and then not really leveraging it for all of its benefits. I think that, we are very familiar with Epic. Epic has a wonderful product, but the implementation is only as good as the organization is willing to change. And a lot of times the Epic implementation comes in and they check the box. It's implemented. I do a like for like. So whatever your system was before, I'm going to implement it right over the top of it. And they're expecting something to change. So there's a huge investment there. And then somewhere down the line, a board member, CEO asked the question, okay, we're spending all this money. We made this investment. Where are the results? And then we're all stepping back saying, well, what are we tracking? What are we trying to do? So at least in our business on the call center side, we try, and it's not always possible, but we try to get baseline measures. We try to get agreement on what the key performance indicators are. What are we trying to do? What are we trying to accomplish? Get the baseline and then monitor the heck out of it.
Do you ever find that monitoring or improving one KPI consistently unintentionally hurts another KPI potentially?
Oh yeah, definitely. The whole how quickly can I answer the phone? So, if my whole entire agenda is I want to answer that phone in 15 seconds or less, I could easily do that. I could staff the heck out of the call center. I could put a ton of people on the phones to answer that call. Now my cost per contact is going up. So it's actually hurting. So that's why we never look at just one KPI. Because they do, Gianna, they impact each other. And if you pay more attention to one over another, that exact example will happen. I also think that the numbers in call centers should be used for trends. It's not an exact science. It's, Monday mornings are typically higher. So do you staff more people on a Monday? Yes. But there's always nuances to that. You have to be able to flex with the demand, not focus just on one of those KPIs, because you will get yourself into a lot of trouble if you're ultimately looking for a holistic, best customer service experience for your patients.
So pickup time is not the be all end all then.
No. And I love when it's funny, because we started changing this, like I said, about 5 years ago. And lately, as we present, you can see the C-level CFOs, CEOs, COOs change they'll either sit up or they'll pay more attention as soon as we start talking about dollars. When I've talked about service level and satisfaction surveys at the end of my phone call and all of that, they didn't really pay much attention to that. They were like, yeah, we need to do that. I don't know why, but that's what they're telling me I need to, we need to pay attention to. Now, when we start talking about, we can remove $500,000 to $1 million out of your call center every year simply by automation, streamlining your process, and then automate those calls. Instant feedback, instant change in conversation. How do we do that? And that makes the conversation a lot easier for them to have with their providers, because now the providers are saying, well, why are we doing this? It's less of, well, we want to answer the phones faster. Now it's more, it'll cost us less. More money in our pocket means more money in your pocket.
Following on from that, I'm curious about how you help your clients balance efficiency with the sort of empathy side of the business to kind of ensure that as you're improving the cost per contact, it's not coming at the expense of the entire patient experience.
We use a lot of tools that have speech analytics in it, and it listens to 100% of the phone calls. So think about that. You're getting millions of calls into your call center, and before speech analytics, you would maybe listen to 1 or 2, maybe 10 phone calls a month per agent. It's statistically irrelevant. They're handling thousands of calls, and you're just picking 10 of those. So we use speech analytics for 2 purposes. One, live, so that we can listen in on a call, and any time that they are saying certain trigger words, that call can be escalated. That call can either be escalated to a human if it's going through the automated channel, or it could be escalated into whether it's nurse triage or supervisor or something like that. If they're saying things, if they're unfortunately, if they're using swear words, if they're frustrated, if they're using things like, this is dire that I get in to see an appointment, those types of phrases, we're able to escalate. And then we look at recorded calls, so the quality of the calls. So yes, it's important that we use single call resolution, we answer the phones quickly, but if the experience on those calls is horrendous, then what are we doing? That's ultimately what we're trying to do, is serve the patient better. So we'll listen to those calls, create scorecards, and then coach, retrain, or take corrective action in some cases with those agents on 100% of their calls, not just 10 calls. So we won't miss anything using speech analytics. That's a great example of technology, being leveraged to help in that whole empathy, patient satisfaction area.
Yeah. What are the types of questions that healthcare companies should be asking themselves to figure out if Singola could actually drive a big impact for them? Because I would assume there would be some healthcare businesses out there that you maybe actually can't do that much for, but then there's going to be a lot that you could create a huge impact for. How should anyone listening to this know if they should work with you guys or not?
Sure. I think having an understanding of what it's costing you per interaction is essential. Having that understanding and where it's costing you the most. I think having a structure that allows for consistency, allows for standards to be put in place. And it's really as simple as placing a phone call or multiple phone calls into an organization. We do that all the time. We'll record the interactions, and then we'll play them for the organization for that same level of C-level. It's very uncomfortable sometimes, because as you go through that process, they know deep down that they have issues, and it's really hard to say, to call someone's child ugly. It's hard to hear that sometimes. But when you go through that and you understand that if I call here, I get one experience. If I call another call center, I get a different experience. Or if I call the office directly, it's a completely different experience. If you're having those type of interactions within your organization, then you definitely have an opportunity to improve your intake operations. If you have inconsistent scheduling protocols across your organization, you definitely need or have an opportunity to correct that. A lot of times we come across organizations with multiple call centers. They'll call us and say, hey, we have 6 call centers. We'd like to consolidate them. We'll do an assessment. We'll say, well, the bad news is you don't have 6 call centers. You have 13 call centers. So there's all these call centers that pop up in the organization that no one even knows about. So if you have that type of structure that it doesn't allow for consistency, it doesn't allow for standards. And who are you going to when you have a problem? If you have 13 different call centers, where are you going? So you don't necessarily have to centralize. You do have to create a consistent structure to manage all of your call center operations.
Yeah. And another thing I'm curious about, you were saying that typically when you work with a company, it might be for 2 to 4 years. What can happen a lot of the time with these projects, as you know, is you make a big impact in that period, but then they just go back to what they were doing before afterwards. How do you ensure your clients maintain and continue the frameworks and the processes that you've built for them, so that there's the long-term impact?
Yeah, I think one of the biggest things is we make sure that they are involved with the engagement from the beginning. A lot of time when we first started, to be honest, we would do it. We would do all of the work, and then we would hand it off to them. And within a year, sometimes less, it would start to fall back onto exactly that, Stuart, their original operating procedures. So what we decided was we need their team. We need to develop their structure, their support team, so that they can work alongside us. And throughout that process, we are developing standards and procedures handbooks. We are creating decision registries because, 4 years from now, someone's going to say, why are we doing this? They can at least refer back to that decision registry and figure out why we are doing certain things. But I think one element of it is making sure that you've got the leadership in place to support the decisions that we are making along the way. One thing I wanted to try, we haven't done it yet, but something that is interesting to us is doing some kind of assessment or audit after the fact of saying, okay, these are all the things that we agreed to do. We put them in place. I don't know, year, 2 years after we're done, go back and say, all right, of all the things that we put in place, where are you? And score them on that. And I think that would be very helpful for some organizations, because when we're done with the organization, or with the project, back to doing business. So it's difficult. It has to be. This is not a project. This is a culture. We are changing the culture of how they are operating and interacting with their patients.
What type of resistance do you usually face from clinical teams when you come in?
Don't touch my schedule. That's the biggest thing that we are getting. Nobody understands what I do. Nobody understands other than the nurse at the front desk. So you can do whatever you want to do, but if you mess with my schedule, then we're going to have an issue. So that's where we have to, as I mentioned, build that trust and the credibility. So we do a lot of calls with their peers for prior clients of ours, because they feel that, wait a minute, Singola's coming in here. They're going to change everything. It's never going to be the same again. I'm not going to be able to practice. So we get their peers on the phone who have gone through this and say, all right, let's talk about what the experience was. Yes, it's painful up front, but going through it, when you come out of it, you're in a much better position. You're messaging less, you're interacting on the phones less with the patients, and you're able just to see them. Your time is spent in the exam room. But I would say that's probably the biggest challenge from the clinical side is their schedule.
And do you ever get pushback as well from any other any people in the sort of C-suite side of the business?
IT, we sometimes get pushback from IT because it is, it's a challenge because we're going in there and we're saying that it's not all about the technology, and this isn't a technology project or engagement. This is a business operations or clinical operations project that you are supporting. Now, we do come across, we've got a couple clients now that the IT department loves us in there because they are getting bombarded with requests and change orders and technology enhancements from across the organization. There's no structure to it. There's no change control. There's no approval process. So that's something that we also do. You asked, the prior question was about how do we keep things in place after we leave. That's another thing of having those workflow approvals in place so that when you want to change a template, when you want to add a visit type, when you want to change your session lengths, you have to go through a change control process that involves the same individuals who created it to change it.
We were talking earlier a little bit about tracking and KPIs and stuff like that. If a company's listening to this and they're thinking, hey, maybe we are tracking the wrong KPIs, what would you tell them are the best KPIs to track? The KPIs that are going to most accurately predict the long-term access performance and things like that.
I would start with getting finance involved and making sure that you are able to drill down into the detail of the cost. So when we talk about cost per contact, let's assume for a minute that everything is in-house. When you're talking about that, what's included? Rent, utilities, everything down to trash pickup, whatever you are paying for that building, in addition to the staff, in addition to the technology, in addition to the supplies, whatever that is, make sure that finance is involved with you in developing that cost per contact. I would say you should start off there, understanding what it truly is costing you per contact. It's eye-opening. It'll start, and I think we talked about the multiple transfers. So if I call into the call center, it's one cost. Now, if I transfer that call over to the office, that's an additional cost. So all of those costs added up are truly your cost per contact. I would start there and understanding what are we paying every time someone calls us. That will drive your decision making. Because someone somewhere will say, well, we should be using self-service. We should be using portals. We should automate. Well, you can't do that until you go through scheduling optimization and you create the standards and you create the protocols. Once you do all of that, then that opens up your opportunities, I guess, for those types of improvements.
Interesting. If you could redesign the typical health system access model from scratch, what would it look like sort of under your leadership?
I sometimes say that I think starting a new healthcare system would be easier than fixing the existing. And I think you'd have to start off with the culture. The culture would have to be, we're all in this together. It's a group. Because where it is today, in some cases, is there's competing priorities. There's competing projects. There's competing agendas. You sometimes get providers that are salaried, and they're going to get paid the same whether or not they're seeing 10 patients or 20 patients. So there's not really an incentive for them to see any more patients. You often have organizations that have multiple projects underway at one time and limited resources. So you've got to also, when you're starting a new organization, if we were, making sure that it's resourced appropriately with the support. We're usually, pretty good on hiring the clinical side, the business side, the C-level side. But oftentimes the support and the prioritization of that support is the hurdle that most organizations have to get over.
Yeah, interesting. In sort of, or when starting an access transformation, are there any steps that are commonly overlooked?
I would say leadership. If I had to look back over 15 plus years that I've been doing this, the deal breakers, or the one pivotal point of a successful engagement and one that is either not successful or not as successful would be leadership. The leadership of the engagement of the organization have to make very, very difficult decisions in an engagement of this size. This engagement touches almost every department across an organization. It can touch everything: clinical operations, IT, HR, finance, purchasing, and you have to have a strong leadership group that are all on the same page, that are willing to make difficult decisions. And when they're not, then you have to figure out, all right, how do we come together, and making sure that we're all working towards the same thing. We have been part of a few engagements where making decisions, it was not a priority. It was, it wasn't they were making bad decisions. It was just that they weren't making any decisions. And then the project becomes stagnant. You get into project fatigue. People just get tired of it. What are we doing? Why are we doing this? So I would say leadership, hands down, over anything else that we have come across, is the most important part of this.
Yeah. What is the best way for anyone listening to this to get in touch with you and Singola?
Sure. They can either go to our website at singolaconsulting.com or contact me directly at aj@singolaconsulting.com. I answer all. We're a small firm. We're about 27 consultants. I answer everything directly. I'm very passionate about what we do. We can't afford any engagements that aren't successful. We can't hide behind, we're small enough. We can't afford to really fail at anything that we're doing. So I take a very important role in every single engagement that we do.
Yeah, fantastic. Any closing comments or questions from you, Gianna?
No, thank you, AJ.
Thank you, guys. This was great. I really appreciate it.
Awesome. And for the viewers and listeners, thanks for tuning in, and we will see you in the next episode.
Thanks, everyone.